All right. Well, I am Mallory. I am a doctor of audiology student in the downstairs first floor clinic at Folsom Hall's Sacramento State University. And I'm here to talk about the importance of audiology and hopefully get some of you to come down to our audiology clinic to get tested. If at any point I'm speaking too fast or you'd like me to speak louder or more clearly, please let me know. Don't hesitate to ask. All right. So go to the next slide. There we go. So what is audiology? Audiology is a misconception that it's just hearing, but audiology also incorporates the balance system as well, because both our hearing nerve and our balance nerve are the same nerve. They're connected. And we'll go over the structure of the ear in a little bit, but audiology is a study of the hearing and balance system and the disorders associated with both those systems. And audiologists, they're going to evaluate, they're going to diagnose, they're going to treat, and they're going to manage hearing and balance disorders. They are not going to be doing MD stuff like an ENT. So if it is something like an ear infection or a medical issue, we would refer you to an ENT, but we do primarily work with hearing loss and managing and treating that, as well as certain balance issues that can be treatable. So going to an audiologist is important for all ages. People do think that as we get older, our hearing is when we should check it out more, but ever since about early 2000s, every kid born at the hospital or within the first month, they have to have a newborn hearing screening. So we want to start from day one, making sure everyone's getting the stimulation that they need. Audiologists are also going to fit, select, dispense hearing aids and other assistive listening devices, which could be like an FM system. It could just be something that you can put some headphones on to hear more clearly. Doesn't necessarily have to be a hearing aid. We also provide education, like today, about hearing loss and how to prevent it to the best of your abilities, as well as helping with research about hearing loss and balance issues.
So the people who staff the hearing aid thing at like Costco, they're audiologists then?
Not all the time. I think some parts of Costco can have audiologists. There's a difference between an audiologist and a hearing aid dispenser. In California, you have to get a hearing aid dispensing license, both for audiologists and just dispensers. But hearing aid dispensers can program the hearing aids and sell them, but they cannot diagnose hearing loss. They cannot manage and treat it. They cannot tell you to get hearing aids. So an audiologist is who's going to come to first to get tested. I know you can get tested there. I'm not sure if every Costco does have an audiologist and staff, but I'm most likely they have hearing aid dispensers. So before I kind of get into some specific vocabulary, I want to show you what the ear is. So we have a picture of the ear here, and I also have a nice model I took from the downstairs clinic. So there are 3 parts to the ear. The most part that you see is going to be this part right here, which is called the pinna, just the outer ear. And the outer ear will go all the way to your eardrum. And behind your eardrum, we have the middle ear. And the middle ear is an air-filled space that contains the 3 tiniest bones in your body. Like so tiny, if you look at a dime, together they're the LIB in Liberty. They're that small. So these 3 bones help with our hearing to help move the sound and make it louder, so when it gets to our brain, we can hear it. Because think of when you run your hand through water versus through air, it's more resistant when you're moving it through water. So those bones help to push it further. So when you get all the, for lack of a better term, the brain liquid, it will go up to our ears and up to our brain, and we'll hear the sound. Behind that, so behind these 3 little bones right here, we have the inner ear. And this is what's in the inner ear. This is called the cochlea, the snail-looking thing. It's also that purple-looking snail there. And that's our hearing organ. That's what has all the hair cells and nerve and all the electrical stimulation to go to the brain. That's what helps us hear. Then you have these, I call them Fruit Loops, but you have these loops on top of the cochlea. And those are called the semicircular canals, and that's our balance system. And together, if you see this is the nerve. It's the 8th cranial nerve, or the vestibular cochlear nerve, which is a fancy way of saying it's the nerve for hearing and balance. So those together, I always forget how to put it back in this model there. Those together are going to help get the signal to our brain to make sure we're balancing correctly and make sure we're hearing all the sounds. All right. Does anybody have any questions so far?
Are you going to cover these? Do deaf people have more balance issues? I'm not aware of that.
They can. There are certain conditions with balance that are just balance and that are just hearing, or they incorporate both. There's like Meniere's disease is a condition that affects your hearing in the low pitches and also causes a lot of vertigo. I'll go over the difference between vertigo and dizziness. But there, for instance, my mother, she has profound hearing loss in both ears, and she does sometimes feel unsteady. So it can kind of incorporate both systems.
Yeah.
Earlier on, you mentioned that you recommend we drop into the clinic downstairs. Do we need the drop in, or
you need an appointment, but we should have someone at the front desk to schedule the appointments. And I'll go over our hours. The appointment, I don't know their lunch hour every day. I think it depends on what classes are going on, but they're open Monday through Friday, 8 to 5 to schedule the appointments. And we have clinic 2 of the days of the week, depending on how many students are currently in clinic.
Thank you.
Of course. Oh, it skipped back. All right, so hearing loss. There are 3 main types of hearing loss. There's sensory neural, which involves that cochlea. Oh, it's gone, but involves the cochlea right here and the nerve. And sensory neural hearing loss is permanent. It's also what we typically associate with age-related hearing loss, because that's going to affect these structures and it's going to be permanent. We also have conductive hearing loss, which involves typically the outer ear right here and then the middle ear. And sometimes conductive loss can be fixed. That would be something you would go to your ENT for. And that can be something like earwax impaction. So if you just have a lot of earwax that there's no sound able to escape through it and get to your eardrum, that can cause a conductive loss. But once you take the earwax out, it can recover your hearing. There's also things like ear infections. When kids are little, they tend to have more ear infections, and that's going to have some fluid behind their ears. And once that recovers, they regain their hearing. So, and also if you have any holes in your eardrum, that can also cause some hearing loss, but our eardrums can be resilient and they can reform. Good. Yes.
The earwax impact, and I was noticing when I was checking out CVS Minute Clinic, they also do ear cleaning. Is that something is that safe to go to them for that, or I
don't know specifically about them. I think it strongly depends on how much earwax you have and where it is. So I didn't bring the fake earwax, it's kind of gross, so I didn't bring it up here. But sometimes we have a whole wall of earwax that can look black and you can't even see the eardrum. And if it's really far back, you want to go to an ENT, or you want to go to someone that's medical to manage that, just in case it's touching the eardrum and you don't want to pull the eardrum out.
And that's something that your doctor, when just a regular ear exam, can't tell if it's there or not?
They should be able to. So with this device, the otoscope, I didn't bring any tips, but you'll look in your ears, and your primary care physician should be able to look in your ears and see if there's any earwax. They can also take out the earwax too. Audiologists can take out earwax to an extent, but we don't want to go too far in case there is a medical situation. But we do have our clinical instructor and the clinical coordinator for our clinic downstairs. She is great at earwax removal. She got a bunch of fancy new tools to remove with some suction. So if you do schedule an appointment and we do see some earwax that is manageable in the clinic, we can deal with it there. Most likely. We'll let you know depending on the situation. Any more questions?
Well, I know you're not supposed to put a Q-tip and stuff, but what causes the itchiness sometimes? Is that earwax, or is that something else?
So itchiness can have a wide variety of factors. Sometimes I have itchiness, but I don't have any, I don't have an earwax impaction. It could just be, some people just have itchy ears. I know it's a terrible thing to just say, but some people have itchy ears. There are sometimes you can use drops to help with it. There's also certain infections that cause itchy ears. It's called otitis externa, outer ear infection, that can make it itchy. Sometimes if you use a lot of inserts, like, I hate to call my mom, but my mom has her hearing aids, and if you don't clean them all the time, then you can potentially get some infection or bacteria in there, and that will make it itchy as well. So it just depends on the situation.
Thank you.
Of course. So there's also mixed hearing loss, which is both conductive and sensory neural, meaning parts of it are permanent and parts of it may be medically managed and improved. So hearing loss can be caused by genetics. It can be caused by loud noises. I've also provided a couple earplugs here to help with those loud noises, and also infection and medications. There are certain medications that we take, and if anyone wants any literature on that later, I can send it out to the clinic, the program here, about those types of medication, but some of those can affect your high pitch hearing. And it, like chemotherapy is a big, what we call an ototoxic drug, which can lead to some hearing loss. So it's always advised that if you're on chemo, to get your hearing checked on a regular basis. Okay. So I've included here just examples of what it looks like when we give you hearing results. So on the right, we have a scale of hearing. So on the top of both of these, it's called an audiogram. That's how we graph your hearing. On the top is the pitches. It goes from left to right, so low pitch to high pitch, like a piano. And on the side here, we have the volume scale. The top is going to be really soft sounds like whispers, and the bottom is going to be more loud sounds like firecrackers.
Are these administered in a booth?
Yes, so downstairs we have 4 booths.
I years ago had mine checked every year because of my work environment, and that's what I did. I didn't know if it had changed since then, but it's basically the same thing.
There are booths for every clinic is going to be different. So our clinic downstairs, we have a brand new clinic. It's been open for 2.5 years, and we have 4 sound booths and suites. So, but there are different styles and sizes depending on the clinic you go to. There still are the booths that are like a telephone booth where you're the only one sitting in it. Yeah, just depends on where you are. So we consider normal hearing for all ages to be between -10 and 25 decibels, so really soft sounds. It says slight right there, and that's for more pediatrics. If they do have hearing between 16 and 25, it could be a precursor to any more hearing loss for kids, but for adults, that is normal. As you go down from mild, moderate, that's just showing you the different levels of hearing loss. And on the right here, we have an audiogram. The blue X's are your left ears, and the red circles are your right ears. So if you see it's going down that way, that means this person has hearing loss. So their hearing loss is mild to severe. Does anybody have any questions on the audiogram?
But just to clarify, they can hear stuff if it's high enough decibels. The decibels go up, right?
Yeah, so they go down. So in the top half where they're more like at 30 decibels. So right here, this is a mild hearing loss. So in the low pitches right here, that's where we have our vowels, and the vowels give us the volume of speech. As you go more towards the higher pitches, because these right here are all the pitches of speech. We just test your speech frequencies or pitches because that's what's most important to people. As we go further in higher pitches, you have your consonants, and consonants give us the clarity of speech. So this person's going to be missing some volume, but they're going to think people are mumbling a lot more. Does anybody have any other questions?
Yeah. So it's not tones, it's verbal sounds.
So when we do this right here would be tones. These
Okay.
pictures, the circles and the X's are the tones that we're playing in your ear.
Okay.
And we'll do some more speech testing. If you come downstairs, we do speech testing as well. But this one's just going to be the tones.
That's what I thought. Okay.
Okay, thank you. All right. So issues related to hearing, it's more than just hearing loss. We also have tinnitus. Some of you may already have that. Tinnitus is the ringing in our ears. It can be high pitch, it could be low pitch, it could be, some people hear music. It just depends on the person. And it's typically something only you can hear. So that's also an issue related to hearing that we'd be more than welcome for you to come to the clinic and we can talk about it. There's also vertigo. So vertigo is when it's true spinning. Everything seems like it's spinning around you. It's more than just imbalance or dizziness, but everything is spinning, and sometimes those episodes last a while. Both of those, we'd love for you to come down here and we can talk about it. And dizziness it is pretty serious. Vertigo is serious. Dizziness is also something that we could talk about and is related to hearing, as we mentioned earlier. And auditory processing disorder, that is when your audiogram is normal. It says that you can hear the sounds correctly, but something on the way to the brain is having a bit of an issue. So you're hearing them, but you're not processing them.
So going back to the vertigo, what if somebody with vertigo comes in, what are you able to do for them?
Well, when you're coming with vertigo, we want to take a case history. We want to test your hearing too to see if anything links up, because having as much information as we possibly can help us when we refer you to an ENT for the vertigo. So if we do a hearing evaluation and you have low frequency or low pitch hearing loss, and you're also describing some other symptoms, like your episodes are lasting 20 minutes and it's true spinning, we can't diagnose the medical condition, but we can give an ENT and we can refer you for our suspicions, our suggestions of what might be going on.
And then somebody could have vertigo with no hearing impairment, and that, what does that mean to say or do? Or
it just depends on, so if someone has vertigo with no hearing impairment, it depends on the other case history questions, what other we gather, because it could be a variety of symptoms. It could be something that they need to go to ENT for. It could be something that we can, as an audiologist, can manage, because there are certain dizziness or vertigo conditions that we kind of put you on a massage table and move your head around to get a crystal back in the right place. Yeah, so there's more tests we can do, but everything kind of has a puzzle piece where you have to connect it. What you tell us what's happening with your life, what the hearing results say, what the balance, like what your balance is looking like. We all add those puzzle pieces together to help us and help you.
Mallory,
Right.
Mallory, is auditory processing disorder the same as auditory perception? Like between vision and visual perception. So the vision might be totally fine, but their ability to perceive it correctly is impaired.
I'm not exactly sure. I haven't heard of an auditory perception disorder, but I will look into it. But I would say that all those things are pretty connected. So we have many cranial nerves, and there are certain conditions with hearing that's attached to vision as well. So it just depends on the case by case situation.
Oh, I just use that as an example, but could you talk a little bit more about auditory processing disorder? Is it possible that someone, if they were in a booth and they were being tested and they were so focused that they could actually hear those tones fairly normally, but they could still have an auditory processing disorder? And what would that be like? Are you able to pick that up and deal with it in your center, or how would you go about that?
So we're working on doing auditory processing disorder testing. At the moment, for the past year, I've been a graduate assistant to one of our professors in the program, and we're working on a long COVID study and auditory symptoms. And she just tested me last week as a practice for auditory processing disorder. Not my favorite test, it is hard. But so as I mentioned, when you're hearing the sounds, you're hearing those tones when we do the audiogram. So it's saying that you have normal hearing.
Yes.
But maybe you're saying it's like, I can hear them, but I don't know what they're saying. I'm okay, thank you. I don't know what they're saying. So there are a couple surveys we can do that we can kind of connect it and be like, okay, we're going to test them for auditory processing disorder. And it just all depends on what you tell the audiologist to make sure that we're moving you on to the right step. But typically with auditory processing, you're hearing it, but we do a test for the disorder, and you're going to be, it's a very annoying test in my opinion, but you hear some things on one side and some things on the other, and you have to say it in the right order that you hear it. It's very hard. Because we're just making sure that it's getting to the brain the right way, or we're seeing where the issue is, and if you do have the disorder. It's a longer process. So if you want, I can also look up some literature and send it to the cardio wellness program.
Okay, and then the last question, it's a friend who says, and she's 80, she says that she's had this all of her life. And it's not, let me see, it's more the ambient noise. If there's anything else going on that keeps her from hearing what she's supposed to hear or something. I think she's got a lot of reason, because she wants to walk around with Bluetooth and music and things in her ear listening to, and it's scary for the rest of us because we see evidence of hearing loss. So we feel like she doesn't need any of those extra things distracting her. But so that idea of ambient, surrounding noise, or multiple noise points, maybe when you're in a restaurant or a group, she can't stand group settings because she can't focus on the speaker when there's any other noise in the room. Is that called something else? And that's my last question.
That sounds like more speech and noise difficulties, and that can be related to hearing loss. Without specifically meeting her and without talking to her about her whole situation, I don't want to diagnose anything.
Sure.
But I would have her come down to the clinic and we can talk through it. All the tests are run by the students there. I'll go over later, but we are all supervised by a certified audiologist in California.
Great.
So anything we do is also checked off, so you can take it to your other doctors.
Thank you.
No problem.
Thanks.
So why should you visit an audiologist? You want to catch that hearing loss early, because the earlier you catch it, the better we can manage it. And you also want to establish a baseline for hearing. Sometimes your hearing is fine, but you want to know that your hearing is fine at this age, and then you get to another age and see how it shifted. If it shifted too fast, then we want to talk about that. We also want to identify any potential issues. So are there any other conditions that are causing your hearing loss? We work with interprofessionally. It's a big thing in audiology to make sure we're working with your ENT or a speech pathologist. We want to make sure that any conditions are not all related, and we're catching that. We also want to prevent further damage. So say that you're working with lots of noise around you, we get your testing, we know what your baseline is, and we can tell you how often you should use your hearing protection. We want to make sure that we're giving our best care to our ears. Navigating issues like tinnitus, as we mentioned, balance issues, even pain in your ear. And sometimes when sounds feel too loud, but they shouldn't be that loud, that could be a sign of hearing loss, even though it sounds counterintuitive. It's more or less that what happens is we have a range of hearing. So if you start hearing at 0 and things are uncomfortable at 100, you have a big range of hearing. But if you're not starting to hear until 70, but things are still uncomfortable at 100, the slope is a lot steeper, so things get louder faster.
Is it because this is your field? I can hear you perfect, and you're not shouting, but I can hear you very well. Is that for you?
I have an audiology voice. I definitely do have an audiology voice, and my mother has profound hearing loss, so I've had an audiology voice my whole life, and I worked at summer camp, so I always heard this. But
I like that. I feel like I can hear it.
good.
Not shouting, it's conversational, but it's hearing.
I'm very glad. All right. So some other signs of hearing loss, they can be subtle or they can be sudden. If they are sudden, please visit an audiologist in the next 48 hours. If you wake up and you have no hearing in your right ear, go to your audiologist. Go to the doctor. Because sometimes we can do measures to help bring it back to an extent. Other signs of hearing loss, you're asking those around you to repeat what they say on a regular basis. You think people are mumbling or they're not clear when they believe that they're very clear. You have difficulty understanding or hearing in very noisy situations. your volume on your TV or your radio is pretty high, you have persistent lightheadedness, spinning, or dizziness can be a symptom we talked about of disorders with hearing imbalance. Also fatigue from listening to conversations. If you feel like at the end of the day you had a very social day and you're exhausted, not because you're doing a lot of things, but because you're talking to a lot of people, that's called listening fatigue. So you spent so much brain energy trying to hear what they're saying, when maybe we can get your hearing checked out, get some hearing aids on there, and it can help reduce the fatigue. Also, persistent ringing in the ears or tinnitus can be a sign of hearing loss. Not always, but it can be. So how can hearing loss be treated? There are hearing aids. So there are various styles. I brought some styles up here. These are shells. They're not all hearing aids, but they're just shells. I have my mother's old hearing aids. There are various styles that will help different degrees of hearing loss. So they're really tiny ones that go in your ear, but the tinier you are, the less power they are. And also, they're hard to change the batteries. I'm just going to put them out there. They are tiny batteries. There's also assistive listening devices. So there's systems that you can wear that it will go directly to your hearing aids or just headphones. They're sometimes vibrating or blinking alarm clocks if you can't really hear an alarm clock in the morning. And there's also Bluetooth, as you mentioned, your friend's wearing Bluetooth. So a lot of new hearing aids have Bluetooth technology that it can put the sound right in their ear. There's also cochlear implants, and cochlear implants are for people with very profound to no hearing. And that's going to put electrodes in that cochlea here. And it's going to do electrical stimulation to help compensate for the non-functioning part of the cochlea. And there's oral rehabilitation. So we know rehab is helping us. It's going to help us regain those abilities. But when you put a hearing aid on, it's not going to solve your problems in one day. It's not like when you put glasses on where like, oh, you can suddenly see again. Maybe a couple hours of dizziness. But with hearing aids, you have to retrain yourself a little bit to start hearing in that new environment. But I've seen people put them on for the first time and it was great right away. But we do, the clinic doesn't offer right now, but there is oral rehabilitation to help learn the skills and strategies to navigate your life with hearing aids and with hearing loss.
So is that something most ENT docs would obviously have referrals and programs like that, right?
They would have have referrals. I believe in our clinic, I can talk to some of our clinical instructors and see what because all our clinical instructors are also coming from different places. So my clinical instructor this semester is a pediatric audiologist at Sutter. So I ask her if I have any pediatric questions. I've had other ones that do oral rehabilitation. Our program director, Dr. Gata, she has done a lot of research on oral rehabilitation. So we can always ask her some questions too. She is on the second floor. So the importance of treating hearing loss can cause some social anxiety. If you're not hearing what people are saying, sometimes you don't always want to be in that situation. So helping to manage that and maybe give you some amplification may help you feel a little less anxious in those social situations. Also, it can help with social isolation. So if we don't hear, sometimes we don't go to those dinners, or sometimes we don't go to those outings with friends and family because we don't want to be stressed or you don't want people to think less of you because you're not hearing them, or you don't want to annoy them because you're constantly asking for repetition. So I'm basing this all on my mother's example she's giving me, but it may help you feel a little more connected to everybody. And there are studies that show that hearing loss and not treating it can be connected to cognitive decline. Because again, it's a social isolation. So if you're not being a social, you are isolating yourself, and that can affect your cognitive abilities. It also prevents auditory deprivation. I like to think of, if you don't get hearing aids or some amplification, think of it as when you break your arm and you put your arm in a cast. After the couple months you take the cast off, that arm is significantly weaker than the other arm that's been working, right? So if you're not getting any amplification, if you're not getting that stimulation to your ear with those sounds that we should be hearing, it's going to eventually get a little bit weaker and not work as well. Also, hearing aids or any amplification device can help you with handling safety situations. So if your friend's not hearing things like a fire alarm that she should be hearing, or she's not hearing the crosswalk sign, she just thinks it's time to go. I know we have a visual thing too, but hearing aids or any amplification in any way can help us become a little bit safer. So, because we are in the cardiovascular wellness program, also talk about hearing in the heart. So there are suggestions and correlations between hearing loss and heart disease. So if you have heart disease, you're not getting that blood flow to your ear, it can damage some of the systems in your ear, and that can result in more permanent hearing loss. So getting hearing aids or getting any treatment or just knowing if you have any hearing loss can kind of help you establish where you are in your health journey. So back to our clinic. So what happens during hearing test? It really is dependent on the clinic. Downstairs, we try to do as much as we can because we are all still learning. And some components of it include otoscopy, which is when I look in your ear. And there's also the hearing evaluation, which we mentioned earlier, is the different pitches and the tones. And we'll put them at different volumes to see what the softest level that you can hear is. We'll also maybe do acoustic reflexes, which is in your middle ear, right in here. There are little muscles that are attached to the bones. And one of the muscles, it retracts when it hears a loud sound. So think of it when you're at the doctor and they hit your knee to see how your reflex is there. We do that with your hearing to see at what level volume does your muscle retract and make sure it's trying to protect your inner ear. And we also do tympanometry, which helps assess your middle ear health. It can see like maybe there's some fluid behind your eardrum, or if your eardrum is particularly moving a lot or hyper compliant, or it's too stiff. It can help us see that, and then we can look at your hearing results too and kind of connect things and see what's going on. We also can do, and typically this is with children, but otoacoustic emissions. It's an objective way of testing some hearing health. There are little hair cells in the cochlea, and while you're not hearing them move, they are moving. So we test to see how much sound they're making, and if they're making a lot of sound, they're working. And if they're not making the sound, it could be a hearing loss. We typically do that with kids who aren't big fans of putting headphones on.
This is all, you get all this information through the headphones themselves?
Yeah, it's a little tiny probe we put in your ear. We put a bunch of sounds in there for like 30 seconds to a minute, and it can tell us at what pitches the hair cells were moving. And if you do have robust, meaning there's a different, like their normal sensation level, if they're robust enough, it tells us, okay, you don't have any more than a mild hearing loss, if you do have any hearing loss. How can we help you with SACS today? So as I mentioned, we have a clinic downstairs. It's on the first floor. It's the Mary Jane Reese Language, Speech, and Hearing Center Audiology Clinic. Our clinic provides our evidence-based practice, and it's also a research space for the students like myself and also faculty. So we are an audiology doctorate program. So we do have multiple years going through the clinic, and we're all practicing our clinical skills until we move into a hospital setting, or our last year, which is called an externship, which is kind of like a residency. We're a donations only community clinic, so there are no fees for our services. We don't currently bill any insurance because everything is free. Our hearing test is free, and you can leave the same day with no bill. What can you expect at the clinic? So all the services are provided by AUD audiology students like myself, and we're working under supervision of a clinical faculty member, our audiologist who is licensed to practice in California. We do have in the downstairs clinic, we have 4 sound booths for testing, and we also have a hearing aid workroom where we can service some hearing aids. So if you need them cleaned, or if maybe it's not working, we can look at it and see where's the issue. Is something that we can navigate, or should we send it back to the manufacturer for them to work on? We also have consultation rooms where we can do hearing aid programming and trials. So if you do find you have hearing loss, we can test out a hearing aid in the clinic and see, yeah, how is it helping you? Do you like it? Do you hate it? Where are we on the journey of hearing? We'll also give you that full hearing evaluation and we'll discuss your results with you. And these are pictures of our actual clinic. So this is a video, hopefully it plays, of our clinic. This is one of our third-year students, Bella. She did a little bit of a tour of the clinic, and you can see what it looks like inside. Yeah.
How long of a process? How long does it take for the whole process?
So this semester for an adult hearing evaluation, we are given 45 minutes. So it should be 45 minutes for us. If you're doing the first years next semester, they do get a little bit longer, because they are still learning, but we've had 3 semesters. We're in our 3rd semester of clinic, so we've gotten a lot faster now. All right, so this is Bella giving us a brief tour of the clinic.
Welcome to the Sac State Audiology Clinic. Right here is our front desk. We have Claudia and Hillary, our front desk team, scheduling appointments and making sure that this place is running. Back here, we have the waiting room area. In the corner over there, we have books and coloring pages for children while they wait before their appointment. And in here, all these people down this room, we have a collaborative space for lectures, doing labs. Over here, we have our first booth in here. There are 4 audiology booths in this clinic. We have the GSI AudioStar Pro 2 right here. We have the Titan by AR Acoustics right here, and that is for conventional tympanometry, wideband tympanometry, and otoacoustic emissions. In here, we have the TempStar Pro 2 for imitance testing, and we have these screens for visual reinforcement audiometry, and have some fun pictures for the kiddos. We have otoscopy and all the audiologic things in here. Now we're gonna go to one of the hearing aid consult rooms. There are 4 of them, and in one of them we have a special surprise for you. And this is one of the hearing aid consult rooms. We have Carl, which is pretty cool. We can do hearing aid fittings, real ear measurements on him. We can also do ear mold impressions. He has a camera inside of his head right here. And when we practice ear mold impressions, we can see what we're doing in the ear canal on the computer screen, which is pretty cool. Right here, we have the Verifig to do real ear measurements and make sure that we're following best practices. And now we'll go to the hearing aid lab. This is where all of our equipment for the clinic is, hearing aids like domes and receivers. We have teaching demos, ear mold impression material. That's the fancy ear mold grinder back there. We have auditory voc potential supplies, hearing fluctuation supplies. We have a bunch of toys when we test pediatrics here as well. The toys are right there. We have a lot. And we have a bunch of cleaning supplies so that we are sanitary and following safety precautions. Over here, we have the computer lab in the clinic. This is where we do clinic reports. Here.
I'm going to stop it here because it's just showing where we're typing your reports after. But that's what our downstairs clinic looks like, and that's what will help do your hearing evaluation should you come.
Is that downstairs or on the 2nd floor?
It's downstairs. So the 2nd floor is the speech clinic. So they do have 1 hearing booth or 1 hearing test booth, but ours is downstairs where the parking facility used to be. I'll show you the description or the map at the end. Yeah, I actually, if you go, like, I exit this building and then there's that staircase directly to your left, just go all the way down and the door there. It's, yeah, very close.
You're affiliated with the 2nd floor.
We do some in connections. A lot of pediatric patients, before they get into their speech services there, they need to get a hearing test downstairs to make sure it's not hearing that's causing their speech difficulties.
So they're separate.
They're separate, but we
Okay.
do, it's the same name. I know it's a little confusing, but it's, they're separate. All right. Oop, I don't know how to stop that. There we go. Okay, so services offered at our clinic. So as I mentioned, we give those comprehensive hearing evaluations for children and adults. We also do hearing aid cleaning, reprogramming, and trials. At the moment, since we are a donations only clinic and are nonprofit, we do not dispense or sell any hearing aids. But we can trial different brands. There are 6 major manufacturers that we have all them for, and we can trial any of those in the clinic. And then you can take that information with you and go buy hearing aids should you choose to. We also do employee hearing testing for occupational health. So sometimes we have all the employees on Sac State's campus coming in to make sure that, hey, if they're a groundskeeper, they're not causing hearing loss with their leaf blower. We also do ear mold impressions and hearing protection services. So an ear mold impression, I brought 2 in, which you guys are welcome to come feel them up later. I think this one's actually my ear. So they're what we fill it in your ear, and we get a mold of your ear precisely, and that is used for getting hearing aids sometimes, but you can also do a couple services where you can get custom earplugs for sleeping, for noise. I've even seen some for if you have Apple AirPods, like the Pro ones, you can get custom tips to go in your ear. So we do those services down at our clinic. We'll take your ear molds for you, and you can send them off to wherever you choose to get plugs. All right. So I already showed you an audiogram earlier, but this is just another one of how we can explain your hearing loss. The yellow part there is what we call the speech banana, but I mentioned that in your low pitches, that's where your vowels are, and where your high pitches, that's where your consonants are. Which button is it? This one?
Bottom.
Oh, bottom one. So yeah, so we have like the TH and S sounds that are in your high pitches, which coincidentally are also the first sounds typically go when you have age-related hearing loss. And unfortunately, S is the most common sound in the English language. So it's also good to see if you have any hearing loss, you want to hear those S's again, with maybe some hearing aids can help. And also it kind of shows you what different sounds are in different volume levels. Well, I'll find an audiogram of familiar sounds in French. But a lot of these sounds are consistent with the languages. Some languages have different phonemes or different sounds, or they add a couple, but we should all have very similar vowels typically. Some have more guttural sounds.
Does the French have more or less sounding?
No idea. I don't speak.
I can ask my French friend. We'll see. But yeah, I just wanted to show you a different way of seeing the audiogram that could potentially help if the other one before was a little confusing. So our hours of service, as I mentioned earlier, we are open Monday through Friday, 8 a.m. to 5 p.m. for scheduling appointments. Currently at this semester, we have clinic on Tuesdays and Thursdays. And we have clinic from 8:30 to 11:30 in the morning and 1:30 to 4:30 in the afternoon on both days. I have clinic from 1 to 5 at 1:30 to 4:30 today. So if you ever wanted to come see me, that's when I'll be there. But we have 7 second years right now. So you can visit any of us and those hours in this semester. Next semester, those hours may change, and we'll make sure to update that on the website.
So a logical approach would be to come down and get your hearing tested and then decide if you need to have any follow-up that you guys could help with.
Yeah, so since we don't sell the hearing aids, if you do have a hearing loss and you're like thinking about hearing aids, if you are motivated enough, we can trial them in the clinic. Since we don't sell them, we can't go past the trialing, but you can see, oh, I like the way this brand or this manufacturer sounds. I'm going to pursue this one, or I'm not ready yet. I just wanted to try them. We're there for you in both capacities.
Are there any follow-ups with you after the fact that maybe you decide to get hearing? I mean, is there another test that you might want to do later or anything like that?
So if you decide to get hearing aids, if you get them through Costco, they are typically going to be cheaper. However, sometimes their technology is 1 or 2 seasons back, and you cannot, they lock their technology, so you have to get them serviced at Costco. But if you get them anywhere else, any other audiologist, you can come to us. If you're like, oh, I can't get into my audiologist, they're really booked, and I feel like it's not quite loud enough. I'll give a personal example. I had a patient come into a clinic and they had gotten hearing aids through a hearing aid dispenser. And that person had not programmed their hearing aids very precisely to their hearing loss. So we tried reprogramming and we gave them the much needed volume they needed. So we can help you out there too. Also, if you have some hearing loss, but it's just mild and you're not ready for hearing aids, you can always come to us the next year and keep testing your hearing until, hey, maybe I am ready to trial this. We're there for you if you want to just keep an eye on your hearing. I don't know if we're going to eventually dispense hearing aids. Probably won't be while I'm still in the program. But if it comes to that point, we'll let you know on the website and we can see where that goes.
Good question.
Yeah.
Is there a phone number we can call?
Yes, it is on the next slide.
That's the part.
Yes, I have these cards at the front that has our business card and our number, but also how to reach us. So we have phone number, we have a fax number, we also have our email and our physical location. So as we mentioned, we're on the first floor of Folsom Hall. So if you're looking at Folsom Hall from Folsom Boulevard, we're going to be on the right-hand side. So go sneak around to the right and there will be a sign. It will look like the sign right there. And that is where our clinic is, right through there. But if you are also in this building right now or in this room currently, you exit the building or exit the room, turn to your left and go down that staircase all the way down to the first floor. Exit the staircase, turn to your right, and the door to your right should be the audiology clinic. Unfortunately, you can't access the audiology clinic from other parts of the building because it used to be the parking. It's not necessarily connected. So you'd have to go down that staircase or walk around the building. But yeah, so call us, email us, fax us. We are there to service you. I hope to see some of you guys come to the clinic. And I thank you so much for your time today. Thank you. Yeah.
You said that Costco is very, I don't want to say the cheapest, but they were reasonably priced. So what's the difference between them and the NIPS?
So everything depends on the manufacturer and the clinic you're going to. A lot of times people think that audiologist prices are very large, but they don't consider the fact that it's a bundled service. So it's the hearing aids and also the appointments with the audiologist. So my mom's hearing aids were a 3-year warranty. So she's had appointments with her audiologist for 3 years. So like, hey, it's not working, or hey, my tubing is a little stuck, or I feel like my ear mold impression is not quite fitting as well. That's all bundled in with those appointments, and it does depend on the clinic. So if you go to a clinic, I would ask your audiologist particularly like what is involved in this this price. But it also depends, and there's also insurance for some. Unfortunately, there's not a lot of insurance for hearing aids yet. They're working on legislation, especially right now for kids. The Let California Kids Hear is a big legislation point they're doing to try to get hearing aids for children because they're not covered as much. But it just depends. There's a wide variety of prices, and it also is incorporated with, it connects to the technology level. So there are more essential or basic hearing aids, and there are like very fancy or high technology ones that have a lot of bits and bobs with them. And those are going to be obviously more expensive, but research has shown that no matter if you get the highest technology level versus the lowest, it's not going to have any impact on your speech understanding. It's going to still offer you the volume that you need. And any hearing aid is a good, any like working on your amplification or getting those sounds is a good one in my opinion. So if Costco is where you would like to go, I recommend getting hearing aids no matter what and seeing if they work out. If you also go to an audiologist that dispenses hearing aids, a lot of them have 45-day trials. So you can try the hearing aid for 45 days, take it out of the clinic and go in all your natural settings and see, hey, do I like it? Is it helping me in these situations? And if it doesn't, you're free to return it in most clinics. Again, ask the audiologist that particular clinic, but that's a fairly standard process. And yeah, do you have any other questions?
But and so the medical, like, I think before I left Kaiser, they used to have a hearing aid office or something at the location I used to go to. Like you know, in the UCD, I mean, I don't know if you know, but do they have their own little hearing?
I do know. So my mom has her hearing aids through UC Davis.
Okay.
I think it's in the Glass Rock building on the main hospital campus is where they have the hearing aids. Kaiser also has it in South Sacramento and in Roseville. And you also do have private practice clinics too that sometimes service your insurance. And there's a wide variety of those around the area. But I do know that UC Davis has, they give hearing aids.
And your mom's happy with them? They're great.
She loves it. Well, on a personal note, she is happy with them, but her hearing loss is so severe that we're looking to getting her a cochlear implant.
Oh.
But so far, she loves her audiologist so much.
You as her daughter, you're happy with them too?
Yeah, no, I'm actually going with her to her appointment for the cochlear implant actually next week. But I've heard nothing but good things. I've met her audiologist. She's wonderful. I've actually had some of the audiologists that work at UC Davis in the past teach in our program. We've had some from Kaiser too. And we've also had so this semester I'm still in the clinic on campus, but next semester I'll be doing an internship out in the field. And in the past, we've had some of our own students go to the UC Davis one.
And your dream when you finish your degree is to go to a hospital-based program somewhere in the audiologist, or where do people like you go when you're?
It depends on what your preference is. I think at the moment I am leaning more towards hospital setting just because I've always been interested in geriatric medicine as well. So that kind of gives me a point. And I can also do the VA, does have a lot of services too for hearing aids. I feel like every day I'm learning new things. Every day I'm learning like what I like. I do love adults. I do love doing adult hearing evaluations. I'm getting experience with pediatrics this semester, so that's been great too. I haven't quite decided yet. I just like everything.
There's probably a huge need for pediatric stuff, right?
There's a huge need for audiologists in general because it's not a huge field. Like I was on a Southwest flight and the person standing behind me was actually an audiologist that works for our school that I didn't know. So it's small connections. So there's always a need because I feel like, and this is my personal opinion, so it's not backed by any science. Our world is getting louder. There's so much more technology. There's so much more like freeway noise and everything going around. But I feel like people haven't necessarily taken all the precautions with their hearing, even though things have gotten louder. So like I'm 29 years old now, but when I was like early 20s, I used to go to like 40-50 concerts a year and not wear any earplugs. My hearing is fine at the moment, but I feel like it's getting louder. So I feel like the need for spreading the information about, hey, getting your hearing check, or hey, you need to wear earplugs, or just the field of audiology is greatly needed.
Are people even aware of the decibel level that impacts the hearing loss? It's 85. I think.
Mm-hmm. If they know me, they are, because I tell everyone.
Because, that's huge and people don't understand that level.
So there's OSHA and NEOSH. OSHA is the one that does safety regulations for various occupational standards, but also they show us what levels of hearing loudness or levels of loudness that we can have and how long our exposure can be. So typically it's about 85 decibels, which is
About 15 minutes.
85 is 8 hours.
Oh,
8 hours. That is your maximum dosage for a day. Now, I don't want to be listening to 85 decibels for 8 hours a day, but some people do with their occupation. But as you add 5 decibels, or if it gets 5 dB louder, it cuts the time in half. So 90 is 4 hours, 95 is 2 hours.
That
And then
makes sense. That's why we were mandated to wear earplugs. Yeah.
So something like a concert, if it's 110, 120, sometimes that takes only a few seconds or a few minutes. And everyone does have different thresholds for the damage. Not everyone's going to get damaged as easily as other people. Depends on our genetics, depends on so many other factors. But being aware of that is the first step. The second step is checking out your hearing and seeing where your hearing's at and taking it from there.
With your energy level, and is there a better time of the day to do this for someone my age?
So it's very quiet in the booth, and sometimes I have had people fall asleep when I am doing the testing. So if energy is a big factor for you, then maybe in the morning.
general question.
It depends on the person. So if you feel like it, sometimes it can be, I mentioned the listening fatigue. It can be a bit stressful to try to listen to those really quiet sounds. I've done about 5 million hearing tests in the past year. We're all practicing on each other, and it does get a bit exhausting.
Yes.
So I wouldn't necessarily like prepare for it, but just keep that in mind that it's sometimes very quiet and relaxing in the booth, and you're listening for a sound and maybe you don't hear it. So it's just kind of nice to maybe close your eyes a little bit, or you're closing your eyes and listening so hard that you fall asleep. It's happened to me. So I would recommend just keep being aware of that, but it shouldn't be a long test, 45 minutes. And that's going to include typically us talking to you about your results and about other things going on, making sure that we have all the information. So, hey, if we see, because we can typically see on the audiogram where if you had noise exposure, like if you had lots of loud noises, that will typically show up in one part. So like we can say, oh, you might have a noise notch. Maybe we want to look into making sure you wear hearing protection. It's just all dependent on every situation. Yeah. Does anybody have any other questions?
You reminded me, when I go to the movie theater, I mean, I like to be able to hear the dialogue, but sometimes when there's special, wars and fighting, that noise, sometimes it's too loud.
Mhm.
So should I have little, just so on that part of the, like the sound effect, when effect, whatever that thing, whatever makes the loud sound.
Mhm.
So-
I personally wear earplugs at the movies. I think it's too loud, but it depends on each person. If you want, I don't know what type of phone you have, but I know on the iPhone, there is an app called Neosh, Niosh, and it's like a sound level meter. You can test how loud the sound is, and it can help you know, like, hey, maybe if it's constantly 95 decibels in here, maybe I do want to wear some hearing protection.
How do you spell it again?
Niosh.
Thank you. That was excellent.
You're welcome.
Yeah, thank you.
Of course. Do I stop something?